Hey guys, Connie here. I am still 5 weeks post-op from my mommy makeover surgery. I wanted to give you guys a sneak peek at how my scars are looking at 5 weeks post-op. I've covered my nipples a little so that I don't get in trouble from YouTube, but I still want to be able to give you a sense of sort of how all the incisions are looking. Maybe we'll start with the breast. So I'm giving you a little view of my new areola, which is a perfect 4 centimeters diameter now, which is apparently, according to plastic surgery, the perfect areola size. I want to remind you that my areolas used to be like this big. They were like little, they were like big bolognas, and now they're like little pepperonis. So the incision right around the areola is very clean, as you'll see, and it's healing very, very nice. I'll say that they're like a nice pink color with like a white line going around them, and they're perfectly circular. There's my other one. And this vertical incision on both sides, I will say that ever since I started wearing the underwire bra, they are actually healing really nicely, and they're getting a lot smoother. So they used to be a lot bumpier. But now with wearing the underwire bra, I find that the implant has really settled and fluffed a lot more, and it's allowed the breast to kind of hang over a bit more than it used to. I actually have a bit of an overhang now, whereas before they were like really up in the air. So now like underneath, that incision is actually kind of hidden because of the overhang that's starting to develop. So there's my anchor incision. There's my vertical lollipop incision, which is healing really nicely. You know, obviously there's like a lot of veins and blood vessels around there that are still healing, which probably makes it look a little bit more worse for wear than it is. But if you look closely at the actual incision, like it's very clean. There is really no color to it at all. It's a white line. I think it's more the pigmentation of the skin around it that is still healing. And that's sort of where they come together there at the bottom. And that's a very important part because sometimes that seam pops on women, especially when they get a large implant like I did. So there you go, that's the bottom, and you'll see how nice and clean all those incisions are looking. I'll give you a quick view of my abdomen area. So I am 1 week into my post-op exercise program. I am starting to do a little bit of ab work. It's looking really rough right now only because I'm still wearing a compression garment 24/7. So the garment gives me a lot more lines than sort of what my natural skin tone would look like. But I do have a nice, you know, definition line here. And if I kind of suck in a bit and flex my abs, they are definitely all there. And so through continuing with diet and exercise, I really hope to get some more definition in that area. The compression is really helping me form this hourglass shape. Sometimes after a tummy tuck, you can end up being quite boxy looking. So this is where, once again, the compression is really coming in helpful because it's helping me suck in this area, as well as pressure still around my flanks where I had liposuction. This area to touch is a little bit, I'd say it feels like there's a bit of a bruise there still, but that's normal. That's from the liposuction. Check out this new belly button. To touch, this is completely smooth. There's no lumps and bumps there. Really, you just, on the very inside of the belly button, if I pull it to the side, you can see the incision, which is healing very nicely. And by the way, all this is very glossy right now because I just put my scar cream on, and I'll explain what I'm doing for scar treatment in a second. But just want you to see how cute my belly button has turned out, and how you can see that, you know, once the inside heals, it's gonna look, I think, completely natural. And then of course there's my tummy tuck incision, and it goes literally from hip all the way to hip. I still have my liposuction little hole there. That reminds me I have to put scar treatment on that. And another liposuction hole right there. I ended up with an incision, if you're wondering why it kind of goes up like that in the middle. So originally, when we were discussing the plan for my tummy tuck, I was told that I might end up with a vertical incision. So you'd have your horizontal and then another vertical one underneath the belly button to basically allow the old belly button to tuck down in there, because sometimes they can't quite tuck your skin tight enough. But I think on the operating table, Dr. Kara, instead of giving me a vertical incision, decided to do this, which is brilliant. And he kind of just did like a bit of a hump, and he incorporated the old belly button in there. And I know that because see these two little stretch marks? Those are the only 2 stretch marks I ever had that were above the belly button, my old belly button, and now they're all the way down here. So I'm essentially stretch mark free. I don't have any stretch marks. These are just lines from my garment. Any stretch marks I did have after having my kids were all below the belly button, and they cut that all off. So I literally don't have any stretch marks except for those 2 that were above my old belly button. They were from where my belly button piercing stretched when I was pregnant. So these are my 2 holes from where my left and right drains were. So I'm continuing to scar treatment that, and you know, to give you a sense of how your pubic area changes after a tummy tuck. So whereas before I would wear these exact same underwear and all my pubic hair area was all in the underwear, now when I wear these exact same underwear, my pubic area goes right to my incision line. So I've gained, you know, a few inches of mons area or pubic hair area as a result of the tummy tuck. And that's honestly very, very common. And this is going to be an area that as soon as I'm allowed to, I'd like to start doing some laser hair removal just so that it's a little easier to maintain. And then eventually I'm really leaning towards getting a nice rose, black and white tattoo right over this whole area that can sort of peekaboo out of my underwear and bathing suits, because I'm not sure if I always want to wear, you know, a higher, that wouldn't be considered a high-waisted bathing suit. A high-waisted bathing suit's usually like literally covers your belly button, but this would be like a mid-rise, like a bikini style bathing suit. And I'm used to wearing very low-rise things, as you can tell from my old underwear that I'm still wearing. So yeah, I'm thinking laser hair removal in that area, and eventually a tattoo would be something I would like, but I'm still very, very far away from that. But anyhow, guys, just wanted to give you a look at what the scars look like, so that you can judge. Once again, that's 5 weeks post-op, and I'm being told that my scars are actually really good for 5 weeks post-op, and I personally feel like they're healing really, really well too. I don't have any concerns for my scar healing. So questions about sort of what I'm doing now for scar treatment now that I've been told I'm allowed to. So my doctor told me I wasn't allowed to start any kind of scar treatment until all my incisions were completely healed, scabs are off, and you know, you have no issues with infection, black, you know, oozing, anything like that. So if you've been following my journey, you know that my incisions have always been perfect. So, you know, I've been able and allowed to start with the scar treatment therapy. So here's a little peek now at what I've been doing. As I described in another video, I've started using these silicone scar sheets that are off of Amazon. And this is sort of how I store them when I'm in the shower, because you need to be able to store them, you know, in a way that they won't stick on your counter and get dirty. And I mean, some of these are starting to look a little gross. That's just glue that's, you know, starting to collect. But these are all clean and sterile from my body. And these are good for 2 months. And if you need to, you can rinse them off. If you ever find you need to rinse them. And I organize them in such a way so I know every strip, what part of my body it was on. So starting from my left hip to my right hip, these are all my hip, my tummy tuck incision ones. And then this is my belly button with my 2 drain holes left and right. And then these are all around my areolas, my left and right areola. And then this is my vertical incision on my right breast. And this goes underneath the breast on my anchor. So I'm putting these on, and you can watch some of my other videos to see how I exactly apply them. But that's the silicone scar sheets. And then also, it's really important to kind of keep your body hydrated post-op, and you don't want to end up with really dry skin, especially when you know you've been in dressings for months now and you have had a lot of different like tape, glue, and things on you. So I'm using bio oil. I find this really nice for hydrating my skin. It also is supposed to help with scarring and stretch marks and uneven skin tone. I'm not 100% sure how good it is for that. I can't speak to it yet. I know a lot of people say it's excellent for scar treatment. I want to believe that this is probably a very mild scar treatment in comparison to some of the other things I'm using. But in any case, I'm really enjoying using this in addition to my other scar treatment products. So I'm kind of using this all over my body to hydrate my skin. The only thing is you have to be careful when you're using this and the silicone sheets that the silicone sheets won't stick on good if you've put bile oil over them. So usually I put the silicone sheets on my incisions and I do my other more intensive scar treatment first, and then I kind of concentrate the bio oil in other areas of my body just to kind of even the skin tone. It's very greasy. But it is nice. And then this is my more intensive option. Now, this is the Stratoderm Scar Therapy Gel. This is a medical grade product. I believe you can only get it through a surgeon. Perhaps you can get it online. I was pretty lucky. I was able to get 2 brand new bottles of this used but unopened off of Facebook Marketplace for $35 for 2 little tiny bottles. Like, these are small, but regular price, I'm pretty sure these are almost $100 a bottle. And I mean, I only started using it this week on my breast and my tummy tuck incision, and you'll see that I'm literally almost done this bottle already. So this, I think, is going to be a very expensive solution for scar treatment therapy, but I am going to use it. I'm going to use the 2 bottles that I bought of this up over the next couple of weeks as like a more intensive initial scar treatment. And then I think I'm going to switch to bio oil and Mederma. Mederma is only $20 a bottle. It's a lot cheaper. And I've had really good results with Mederma in the past on my forehead scar when I whacked my head. So I'm pretty confident that Mederma is a really good product. So I'm going to test it out on my tummy tuck scar and see if it's good. So anyhow, guys, this is what I'm doing for scar treatment. I gave you a quick peek at what my scars look like 5 weeks post-op. I hope you guys are as excited about my results as I am. I'm really, really happy overall. And I wanted to give you guys a sneak peek at how things are recovering. And so you know what to expect. Have a great weekend. Bye.